Hello and welcome to today's session. Today we are looking at nursing diagnosis. We'll define what is a nursing diagnosis, try to create or derive a nursing diagnosis, and finally give the different 5 types of a nursing diagnosis. So a nursing diagnosis is a critical step in the nursing process where nurses identify and analyze patient health needs, problems, and potential risks. Nursing diagnosis normally help develop a comprehensive plan of care tailored to the patient needs. Okay, we normally refer to it as individualized care. So nursing diagnoses are distinct from medical diagnosis in that for nursing diagnosis they focus on the patient's response to their condition rather than the medical condition itself. So we normally treat human responses to illness, as to say. So nurses when deriving nursing diagnosis, they normally use NANDA. Okay, so NANDA gives or provides some standardized nursing taxonomies. So we select on based on that. Guys, it will be a prudent idea for you to visit the NANDA website and see how different nursing taxonomies are created. So this diagnosis help us to create a care plan that includes interventions to address the patient's specific needs, promote recovery, and enhance overall well-being. Yeah. So nursing diagnosis serves as a basis for planning and implementing appropriate intervention to address the patient needs and improve the health outcome. So guys, so how do you create a nursing diagnosis? So guys, we normally start by okay, we can give an example of impaired skin integrity. Okay, so before you write the impaired skin integrity, so what should we be looking at? Number one, we are supposed to be looking for the diagnostic label or the problem. So what is the problem here? Impaired skin integrity. Okay, so from the problem you go to the related factor. So the related factor, this is the etiology. Okay, it's the etiology that explains this, that explains impaired skin integrity. Someone can have impaired skin integrity because of prolonged immobility, because of inadequate nutrition, or moisture from the incontinence, guys. So from there, after picking the risk factor, you go to the evidence or the defining feature. The defining feature for impaired skin integrity is patients could present with skin redness or breakdown of skin tissues, or patient could be presenting with open wounds or ulcers. In that case, the patient will be having impaired skin integrity. So we can write this nursing diagnosis as what? As impaired skin integrity. This was the problem. Related to prolonged immobility, this was the etiology. So someone could have prolonged immobility, or could be related to inadequate nutrition, or could be related to moisture from incontinence, guys. So as evidenced by, could be skin redness, could be breakdown, could be open wounds. And that's how we write a nursing diagnosis, guys. We write the diagnostic label, we write the risk factor, and lastly, we include the defining feature. Remember, the diagnostic label or the problem should accurately reflect the patient's condition. Okay, the related factor should explain the underlying causes of the problem, and lastly, the defining characteristics should provide concrete evidence of the problem. So guys, there are 5 nursing diagnoses. We could have actual nursing diagnosis, risk nursing diagnosis, wellness nursing diagnosis, possible nursing diagnosis, and lastly, syndrome nursing diagnosis. So for the actual nursing diagnosis, actually we have covered, okay, and we say we normally put it in a 3-part nursing diagnosis, and the best example we have given is impaired skin integrity related to either prolonged immobility, inadequate nutrition, or moisture from incontinence as evidenced by skin redness, breakdown of tissue, and open wounds. Risk diagnosis is a 2-part, okay, so we could say risk for falls related to either unsteady gait or use of sedative medication. Wellness diagnosis, we could talk of maybe you have been having a patient with DM and you have given health talk and you've seen the problem is the readiness for enhanced nutrition, and you have seen the patient express willingness to learn about and follow a balanced diet. So you can come up with a nursing diagnosis as readiness for enhanced nutrition related to expressed willingness to learn about and follow a balanced diet. We also have a possible nursing diagnosis. Okay, so guys, risk and possible nursing that they are different. So like the problem here could be possible impaired gaseous exchange. The risk factor could be patient with a chronic respiratory condition. So that's what you say an example as possible impaired gas exchange related to patient's history of chronic respiratory condition. So here further assessment is required. The last one is syndromic nursing diagnosis. Best example is disuse syndrome related to immobility or muscle atrophy and decreased activity tolerance. So remember, each nursing diagnosis serve a purpose in identifying and addressing patient needs and problem. So guys, those are the 5 different types of nursing diagnosis. Remember to get and attempt the free quiz in the description section of this video just to test your knowledge on nursing diagnosis.